So the last drug that we're going to cover are included in the cannabinoids category. And so specifically, we're going to talk about marijuana. And the main psychoactive ingredient in marijuana is tetrahydrocannabinol, or THC. And so many people are aware that we look at sort of the potency of marijuana's psychoactive level by saying how much THC is in it. And we know that, for example, CBD is in marijuana, but that's not where you're getting the psychoactive component. So people have become a lot more educated on that recently. So that's, really interesting in terms of our knowledge of marijuana. We do have endogenous cannabinoids that we experience in the brain. And those cannabinoids, remember, endogenous meaning internal versus exogenous, which is what we would put in the body. These kinds of cannabinoids are really important for development and just part of the process of our cell lifespan. So this graph only goes to about 2010 or 2011 or so. But as you can see, that marijuana at one point was just as common as cigarette smoking in 12th grade students. And I'd be interested to see, even in the past, 10 years, how this has changed in terms of this graph. So this is a bit outdated, but I like to see how over the course since 1975, over the course of several decades, how marijuana has dipped in comparison to cigarettes, and then at one point even becoming just as popular in terms of smoking. And of course, legalization is going to change this relationship as well, and it's becoming legal in more and more states. Doesn't change the fact that, you have to be of a certain age to acquire it. So what does marijuana do to you? In low doses, it can increase your sense of well-being. It can make you a bit restless. Sometimes people get really silly. They sort of experience, hilarity and then feel very relaxed. Alters their sensory perceptions. They might experience very small hallucinations. Obviously, it's going to increase appetite. A lot of people say you get the munchies. When you experience really high doses, now you're starting to see some memory impairments. Individuals might have issues carrying out tasks that require like some planning where they have to actually do, step by step, do something, and can also experience slurred speech. This is an example of an injection of THC and the dopamine release. As you can see, THC will give you that really sharp dopamine release that we see in other drugs like stimulants and opioids. And so this would be a placebo. You can see that it doesn't do anything in terms of dopamine release, like a saline solution, for example. So this is specifically in the nucleus accumbens, and we see that happening in many of these types of drugs, of this really sharp increase of dopamine release, specifically in the nucleus accumbens. We do have several cannabinoid receptors. We have them in the nervous system as well as the immune system. We have them spread out in different projections like the substantia nigra, the hippocampus, which is probably why our memory can be affected by it. The cerebral cortex and cerebellar cortex can have, especially when we come to the cerebral cortex, some pretty extensive projections. We know that it does act directly on those dopamine receptors in the nucleus accumbens, which is how we see this happening at such a sharp increase. So there is a question about why do we classify marijuana as a Schedule I drug? So if you go to the government website, you'll see that marijuana is listed as a Schedule I drug, which means that it has a high abuse potential but limited or no medical use. Even though we're seeing it change in terms of legality, We know that marijuana has been shown over and over again to be really effective to relieve nausea with things like chemotherapy. It helps to stimulate the appetite. It helps with glaucoma, for example. If it works, and another major thing is it can reduce seizures, especially in some really severe types of epilepsy and other conditions. So the question is, if we know that it works as a really effective treatment for different reasons, why is it still a Schedule 1 drug? And this is a very political question, but to answer it pretty simply, there's just not as many clinical trials that show that the benefits of the treatment outweigh the risks that are associated with the drug. What we need is studies that are really well defined with measurable ingredients that are the same standard unit from one point to the next. So we can't say, oh, we have a dozen different studies. They all use different dosage with different levels of THC, measuring different things for different conditions. If we can have really standardized treatments across many different clinical trials, that can help doctors determine the dose and frequency of those doses to treat the illnesses. Now, that's not to say that clinical trials are not currently being done, because they are, and there is and has been evidence for using marijuana as treatment for many different kinds of conditions. And I think that what we're going to see is some more movement toward seeing marijuana being used in a clinical setting. Now, historically, marijuana has been a big, has been a big faux pas against marijuana because of political reasons, which we're not going to get into here. But I will say that a lot of the drive to put marijuana in this category of, it's extremely dangerous gateway drug, a lot of that has been political. This last slide is just some of the common drugs of abuse. We've talked about some of these, for example, the opioids and opiates specifically. We talked about some stimulants, but these are just some really, this is a really good kind of summation of what type of drug and then what kind of receptor site of action that we see these drugs acting on. So if you have any questions, you can email me, and I will be happy